Hello, my name is Lorraine Bonkowski, and I am a registered dietitian at Michigan Medicine's Hepatology Clinic. In this video, we will discuss why a high-protein diet is helpful for patients with cirrhosis and how to follow a high-protein diet. Malnutrition is a frequent concern for patients with cirrhosis. Cirrhosis causes a disruption in nutrient metabolism, and our liver has a hard time storing energy the way that it normally would. This can lead our body to rely on breaking down our own muscle mass to get the energy that it needs instead. On top of this, patients with cirrhosis generally don't feel well, so they're not consuming as much food as they normally would. We encourage a high-protein diet in order to help preserve muscle mass and prevent malnutrition. High-protein foods include meat, fish, eggs, dairy products such as cheese and yogurt, beans such as black beans or kidney beans, nuts, and seeds. On average, aim for about 1 gram of protein per kilogram of body weight. However, this number can change based on the patient, the severity of liver disease, as well as any other health conditions they might have. It's always best to ask a registered dietitian for a more personalized protein goal. To get enough protein in your diet, make sure to include a source of protein at every meal and every snack that you eat. Try also not to go long periods of time without eating, and don't skip meals. If you are struggling to meet protein goals, consider nutritional supplements such as Boost, Ensure, or Premier Protein. There are many nutritional supplements now that have up to 30 grams of protein per serving. Here is a table showing some examples of high-protein foods. Meat and fish are roughly 21 grams of protein per 3 ounces. Greek yogurt is another great high-protein food at about 20 grams of protein per serving. There are also plenty of plant-based proteins for people that might be vegetarian, vegan, or having trouble digesting meat. You can see that just 2 tablespoons of peanut butter have as much protein as 1 cup of milk. Some high-protein foods could also be high in sodium, such as cottage cheese, deli meats or cheeses, and canned beans. So keep this in mind if you've been told to follow a low-sodium diet as well. For patients with cirrhosis, it is also recommended to have a bedtime snack containing protein plus a carbohydrate. This helps reduce the amount of time that someone is fasting overnight and helps decrease the risk of malnutrition. Some snack ideas include peanut butter on toast, crackers with cheese, fruit and a handful of nuts, yogurt, or a nutritional supplement. If you have more questions about a high-protein diet, consider making an appointment with a registered dietitian. We hope that you enjoyed this video.